caring about, like Jake was saying, like we really gotta, this cannabis and the endocannabinoid system is all really, I think, is part of this larger wave of public health, because it forces, it's a new understanding that connects a lot of these disparate things in the human physiology. And I think mind, body, spirit, and also maybe even the social level, there's a lot of interesting work on social exclusion and the impacts that has on the cannabinoid tone. And if you actually take cannabinoid booster like Tylenol before you play a psychology game where you get excluded, like there's some studies where they've done this to poor volunteers, like you're playing at something and they're like, oh yeah, you can't be on the team anymore. They just randomly kick people off. But if
they lose their empathy.
Right. But yeah, well, if you take, well, first of all, when you get kicked off, like apparently if you take Tylenol beforehand, you don't feel as bad. And I don't know if that
right. That's the empathy part. The empathy part, yeah.
I don't. You just don't care. You're not as empathetic with your, like if you are more empathetic, you might still feel better or worse. I don't really know. I'm kind of confused as to, because I've also read that Tylenol can blunt empathetic responses.
Right.
But it also
so it blunts empathy. It also blunts performance, anxiety, and assessment of quality of personal performance, kind of similar to alcohol, where people think that they're driving better than they actually are. So,
or singing better.
It's actually a pretty powerful psychoactive drug.
Yeah.
Well, yeah, and the whole. I mean, personally, I will take buffered aspirin before I do a big travel, not for the anti-inflammatory aspect, but because I've just found that it really helps my stress as I'm going. The TSA line, that stresses me out. I'm like, are they going to get me? No, I mean, I'm just kidding with that. But I found, I mean, that's just a personal observation, and I just realized that over a number of times where I might have had a sore back or a sore neck and I was traveling, so I would preload with I usually prefer aspirin if I'm going to do an anti for personal reasons, but I found it very good for stress relief, and so
that's interesting. I mean, people don't talk about that aspect of aspirin much at all, and could be this the new old understanding of inflammation is really not just Greg Gerdeman was recently interviewed. He's back in Tennessee. I don't know if you guys know Greg. He's a brilliant PhD. You guys know Greg Gerdeman? Have you come across him before? Oh, he's like one of the most brilliant cannabinoid scientists that I've had a chance to meet over the years. I've been Gregory, last name is Gerdeman, Gerdeman, maybe two N's in his last name. He was one of the first people that discovered retrograde signaling in endocannabinoid synapses under NIDA when he was doing his PhD or postdoc. NIH, NIDA grants, so he was really on the cutting edge of cannabinoid physiology understanding in the 90s. And I met him at an ICRS meeting in 2005, and we've been friends ever since. And he kind of then became a professor in Florida, and now he's pivoted into kind of cannabis science officer for companies and things like that. But he's an excellent communicator and educator. He was the go-to guy for explaining at the American Chemical Society special section on cannabinoids what's going on with delta 8 THC and like the whole what's that all about, and like what do we know and don't know. Anyway, so he had recently did an interview. He's back in Tennessee where he grew up. He's kind of moved there, and the local paper, because there's no law for cannabis in Tennessee, or there's nothing really like legitimate, so people are still trying to prevent themselves from going to jail for talking about and using what we're talking about here. I think it's still kind of in that world. I don't know. Anyway, but he was saying the big three for cannabis, that delta 8 can potentially work for that. He was like talking about pain, anxiety, and then sleep. But then with the anxiety, he says anxiety / inflammation. So like he kind of puts anxiety and inflammation on the same part of the stool, which was it was nice to sort of see that kind of aha that he was
I like
You know,
that.
he's
Right.
saying,
And to tie in with kind of what Karimet was talking about in terms of, do we talk about cannabis in terms of a health model or a pathology disease state model? A lot of the times, what I've been talking about lately is I use those big three, but I'm going to start adding the inflammation, pain, anxiety, and sleep. So many patients with other conditions you have a diabetic patient with osteoarthritis and knee pain that's preventing them from sleeping. The cannabis likely cannabis stands a good chance of helping them sleep, but it might also help with the knee pain and the osteoarthritis. And, you know, if there's THCV, it might actually also impact the blood sugar.
diabetes,
So,
yeah.
so many patients have one of those big three. So to utilize cannabis or in conjunction, with, Crohn's, a Crohn's disease patient just had a hip replacement, 3-4 weeks ago. And is just wanting something a little bit to take fewer NSAIDs. You might be treating a specific problem, but it has global impact. Kind of like what you were talking about with the fifth wave, all of these things we see interconnecting. And now finally we have a system that we see is essential for the proper working of all the other physiologic systems.